nice to go to jail. There are nicer ways to do it, but the nice ways always fail. It isn't nice, it isn't nice. You told us once, you told us twice, but if that's freedom's price, we don't mind. No, 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 we don't mind. No, no, no. Yeah, we tried negotiations and a token picket line, but nobody seemed to hear it. They might as well be blind. When you deal with men of ice, you deal with ways not so nice. But if that's freedom's price, we don't mind. No, 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 we don't mind. No, no, no. They kidnapped boys in Mississippi. They shot Megger in the back. Did you say that wasn't proper? Did you stand out on the track? You were quiet just like mice. Now you say that we're not nice. But if that's freedom's price, we don't buy.
La verdad. Os amo idealismo y realismo. Como agua y piedra, sois partes del mundo, luz y raíz del árbol de la vida. No me cierren los ojos, aún después de muerto, los necesitaré aún para aprender, para mirar y comprender mi muerte. Necesita mi boca para cantar después, cuando no exista, y mi alma y mis manos y mi cuerpo para seguirte amando, amada mía. Sé que no puede ser, pero esto quise. Amo lo que no tiene sino sueños. Tengo un jardín de flores que no existen. Soy decididamente triangular. Aún echo de menos mis orejas, pero las enrollé para dejarlas en un puerto fluvial del interior de la República de Málaga. No puedo más con la razón al hombro. Quiero inventar el mar de cada día. Vino una vez a verme un gran pintor que pintaba soldados. Todos eran heroicos y el buen hombre los pintaba en el campo de batalla muriéndose de gusto. También pintaba vacas realistas. Y eran tan extremadamente vacas que uno se iba poniendo melancólico y dispuesto a rumiar eternamente. Execración y horror. Leí novelas interminablemente bondadosas y tantos versos sobre el 1 de mayo que ahora escribo solo sobre el 2 de ese mes. Parece ser que el hombre atropella el paisaje y ya la carretera que antes tenía cielo, ahora nos agobia con su empecinamiento comercial. Así suele pasar con la belleza, como si no quisiéramos compararla, y la empaquetan a su gusto y modo. Hay que dejar que baile la belleza, con los galones más inaceptables entre el día y la noche. No la obliguemos a tomar la píldora de la verdad como una medicina. Y lo real, también, sin duda alguna, pero que nos aumente, que nos alargue, que nos haga fríos, que nos redacte tanto el orden del pan como el del alma. A susurrar, ordeno al bosque puro, a que diga en secreto su secreto, y a la verdad, no te detengas tanto que te endurezcas hasta la mentira. No soy rector de nada, no dirijo, y por eso atesoro las equivocaciones de mi canto.
No, I can understand the what you're saying, not even from what someone says, not from a reactionary point of view, but from the point of view that if I was on the other end, well, I could understand the employees being, and that has less of an impact than if an individual who is not an employee of the institution to come out and say it. I understand that very fully, right? But when you do things this way, that's the way it works out, period. And I think people better start accepting it. That's the way we work here in the ghetto, okay? And it can't work. Listen, I've been down here for a long time, and I can deal with a structured situation, and I can deal with an unstructured, wild type situation like what we have here. And that's what we have here, one of those wild situations.
I'll tell you a story of long ago.
Die Meise ist gar nicht freilich.
It is not a happy story.
Die Meise hebt sich ohne.
The story deals with
Mit a jüdischen Wähler.
a Jewish monarch.
Lulinke mein Fegale, Lulinke mein Kind,
Hab ungeboren als a Liebe.
Paging Dr. Dada, call extension 4105. Paging Dr. Dada to call extension 4105.
Shut up.
Honorable Member of City Council, distinguished members of our Community Board, senior officers of the Health and Hospitals Corporation, the President of our auxiliary, committed citizens of the Lower East Side, my fellow co-workers. Once again, my commitment to the people of the Lower East Side, the patients and my co-workers, compels me to appear before you in the face of an unprecedented and devastating crisis which threatens the very existence of our community hospital, Gouverneur, which many of you here presently have struggled so vigorously for a span of 3 decades to bring into fruition, suffering personal hardships, privations, arrest, imprisonment, persecution, insults, and defamation, because you fought unselfishly and unyieldingly for the most noble and sacrosanct of causes, treatment of the infirm and saving of human lives. My co-workers who have dedicated themselves to serve and treat the sick that come to us for help, relief, and cure, and our patients who confide in us for the care of their illness and disease. I say to all of you today that negative and regressive forces of the oligarchy and reactionary elements are moving fast to destroy our ability to serve our community. And to exist as a viable institution. I'm certain that you are aware of the series of articles that appeared in the press as of Sunday, January the 5th, and all through the week, with first subtle and then direct attack on our hospital, with misleading, slanderous, and insidious innuendos culminating in a statement by insensitive and unscrupulous officials calling for the closing of our hospital after 2 years of operation. These are the enemies of the people, whom we have to single out and expose publicly in due time, for the people who sit in judgment to openly condemn these arrogant despots and cowards who for fear remain anonymous, but we know who they are and whom they represent. We have withstood the horrors of arbitrary budget cuts and have lost $1,850,000 of funds for this fiscal year, rendering our operations extremely difficult at a time when the need is growing and more demanding. Yet today, we are confronting our greatest challenge, to resist with all our might, and even with our existence, to protect and save our community hospital. For we the people have no fear and stand together to defend what by right belongs to the people. Gouverneur belongs to the people of the Lower East Side, who paid a very high price for it. No one, in spite of how powerful he may be or believed to be, would dare to destroy it. For I say, if Gouverneur goes, I promise you, so the system will perish. We will not compromise our principles. We will make no deals. We will not give in. We will not continue handicapped. We loudly and boldly demand a full hospital with surgery and obstetrics for all our people. I therefore reaffirm to you once again in this critical and solemn moment in our short history at Gouverneur, my total and unconditional pledge of allegiance to the people of the Lower East Side to serve this community with loyalty and dedication. For I'm committed to execute your mandate as I recognize the supreme and indisputable dynamic and progressive leadership of our people, and as your instrument I shall translate your aspirations and goals into reality. It seems that war has been declared to the people of the Lower East Side. Victory is our goal. Unity is our battle cry. Death to the reactionaries who strive to destroy us. We shall conquer. This is the beginning of victory, not defeat. Once again, I repeat, if Gouverneur goes, so shall the system. Victory is our goal.
My question at this point is, where is this $10 million going to go? Okay, if the city's saying they're going to save $10 million, our patients got to go someplace. Our inpatient services have to be channeled through another source. So that means that the affiliate, okay, if that's the political game that is being played at this time as a football game, okay, that means that the affiliate will be picking up the inpatient service. That means very clearly, and it's very clearly stated at that point, that the affiliate will be making those $10 million. The city will not be saving any money at this point. The city will be overspending money.
That's the other point.
Yeah, right.
It's the same thing with Morrisania. They expect to close Morrisania to save money, okay? And that's what it says in the news article, quoting the minutes of the meeting of the board of directors of the corporation. To save money, they're going to close Morrisania Hospital. And they're going to save $23 million, something to that effect, some figure like that.
Yes.
But then they're going to have to pay the affiliate, the voluntary, Montefiore, $23 million. So where are they saving the money? So obviously they're not doing it to save the money, okay? Because if they're gonna save $10 million by closing the inpatient service here, and then give it to Beth Israel is no dummy. They're not gonna take it lock, stock, and barrel like that. You give me the hospital plus on $10 million for operating, and that's how it was going. So they're not saving any money. So there's another.
It's going to cost them more.
It's another. So this is what leads me to, at least, of course, it leads me to suspect that there is more to this thing than it appears.
Well, definitely.
Okay.
You know, when they adopted the resolution, of closing Morrisania Hospital, and to build the Fordham Hospital. Yeah, I really don't see any, direct relationship with that.
Well, the gift that they're making to Montefiore with North Central Bronx.
Right.
You know,
It will take years before Fordham gets built.
Right.
By the time this Morrisania gets phased out,
It took 30 years to build this one.
it's a game. You
And
see.
this is rather than make Gouverneur a complete hospital, Beam, Trussell, and Silver have made a deal to close the inpatient service of Gouverneur and shuffle all of our patients, all of our people to BI for experimentation and research. What does this deal mean to workers and patients at Gouverneur? 250 people will lose their jobs. All right?
More than that.
All right. All right.
Well, let me tell you something,
5,000 people, whatever it is.
Paul, but when we say patients, most of the people that work here at Gouverneur are also patients of
Okay,
Gouverneur.
all right. We don't have to get into all that now. I don't
Why
think
can't we make it a broader
whatever it is, all right? The idea is that
Well,
we
let's
gotta
do it.
have as many people, workers and patients and doctors and nurses and everybody, as many people as we can to support our point.
Okay,
Period.
but,
All right?
but, under one consideration, and she made it very clear before, and that's what I'm trying to clarify here, what she said. I don't know if I'm getting the right message of what she's saying. I'm saying that the Lower East Side Patient Association started this fucking fight against the BI and the Health and Hospital Corporation thing a little over 3 weeks, and all I'm saying is, any organization that wants to come in and support, to save Gouverneur, the fucking name don't mean nothing.
Exactly.
It don't mean nothing.
I disagree.
So if that,
It doesn't mean
I
anything.
disagree
No,
on
if
that.
It's a
that-
I
bipartisan
think we
shit.
should have a broader name on it.
if that's the
Okay,
case, why
fine.
can't we come up
We
with
have
what a name of
concerned
it?
citizens of the Lower East
Or
Side.
maybe some kind of ad hoc committee or
That's
something.
right. What am I going to say to the workers who have been fighting the budget cuts since July? Okay? And you can't just ignore the union meeting they held. We're trying to get DC 37 to take a fucking stand to protect workers. You can't ignore them. And this is just like a kick in the face to them. You just call it patient association. They're saying, okay, here they go again, community against workers. I mean, a coalition to protect Gouverneur, something.
Okay, better that coalition.
Combination of both. Or, you know, some
Coalition.
With some kind of name,
Concerned
you know, and
citizens of the Lower East Side.
That's it.
Yeah, but we're the only ones that put our
let's not-
fucking jobs on the
okay.
line to get our ass kicked in
Let's
without
not
trying
get
to demand
into all that
for
stuff.
fucking raises.
Okay, the public meetings on Thursday at 11 a.m. The name of the organization will be a coalition, a coalition of what?
Against closing of Gouverneur Hospital?
Yes.
Or whatever.
Against
This one.
the
Still against it.
Partner.
I think you should read the Lower East Side Patients Association in conjunction, okay? In conjunction, okay? With many other groups, including health working groups in the Lower East Side.
You said the name doesn't matter.
Yeah,
Well,
right.
To me, that particular names matter because to me, these are the same people, that are getting their asses kicked in by the fucking physician, by the fucking clerk, by the security guards, by the fucking board, everybody else, and we sit around here demanding for fucking raises for all these cocksuckers, simple as that.
Well, David, you
Don't
have to realize-
shush me, goddammit.
But you're talking too loud, but you have to realize,
It's the truth.
you have to realize that there's
I'm
a lot of
fucking
concerned
bitchy
people.
about it.
It's chow time for me. Sorry.
Ah, no, man, Paul, you started your shit already.
Come on, God, for God's sake.
Yeah.
Don't you know that the corporation, when they don't want this thing that happened, because once before, the health council took them to the court, and they are afraid being dissolved the corporation. The corporation don't want nothing like this.
What do you mean the corporation?
The corporation don't want that we get together and fight this, because Bing is waiting to dissolve the corporation.
Excuse me? You mean the corporation doesn't want us to get
Of course, when we start putting pressure to them,
But we're not really.
Where you got that name?
I have that idea, the idea that comes to my mind, that flash.
The only way Gouverneur could be saved is that these workers are not to be laid off.
The goal is to make Gouverneur into a truly public community hospital. By that, I would say my concept of a community hospital may differ from other philosophies. Throughout the country, you see hospital names like such and such a community hospital, but in fact, it's community. You know, the word community is there more by name than than any real substance of community at all, because most of these hospitals are private hospitals that call themselves a community hospital. To me, a community hospital is an institution that serves the community. It's one where the community is in partnership and in communion with the hospital, with its activities, where the community is directly involved and participates in the policies and deliberations concerning their institution. Even beyond that, as an institution or a center whereby the community can have their gatherings, their meetings, where cultural events are held for the patients, the staff, and the community, and where other programs, whether health-related or not, are held within the premises for the people of the community.
The only way Gouverneur could be safe is that these workers are not to be laid off.
Well, I understand that there is a list, a senior clerks and supervising clerks list coming out very shortly. Now, this will affect the entire institution. Now, imagine someone that lives in the community, has worked for the hospital for 2 or 2.5 years since we opened, knows the job, knows what's going on, but have to be separated, and someone else coming in that has no notion of the job, does not live in the community, that by law has to take that job. I think that's a very, very important
So
thing
what's
that
your
has to be
position
taken.
on that?
It's not a matter of position. We oppose it. I've always opposed it, but we have to see what we can, what can be done in the particular case of Gouverneur Hospital. It's not a matter of position. You can take any position you want. You be very firm. But if they say you have to take this person, and no check is issued out to the other person, why talk about positions there? The position is very clear and defined.
No, but the thing is that you said you oppose it, but what will happen in reality?
In reality, they say you have to take it. There's no check for the other person. It's as clear as that.
You have to take it.
You see,
It's a civil service thing, Yeah. Here we are making an exception.
Here's a perfect example. We have yeah.
So if you oppose it, then why can't you oppose the mayor?
Well, we're doing that, but that's a redundant.
The only way Gouverneur could be safe is that these workers are not to be laid off.
Well, when I first arrived at the hospital, I wasn't that familiar with the relationship between the affiliation and any community hospital. I feel that the affiliation are professional people. They provide the physicians, the doctors, which is the single most important element in medical care. And I feel that maybe the community are too radical, and they don't really want to understand what the affiliate are thinking of. But then after working here for about 2 years and beginning to analyze the doctors, scheduling of doctors, and beginning to beginning to look at the quality of care a little bit, I feel that really our affiliate is not providing responsible quality type of care. Having a small amount of attending might mean the quality is the residents or interns has no supervision. That means only inexperienced people are taking care of our patients. I don't know, but we find out things like that, and all we do is we write a report.
And what happened to those reports?
Well, we really don't know.
What did you do with the report? Did you burn them or something? What did you personally do with the report?
Well, we handed it in to our boss.
The city, has, it's incredible how the city works. Like the affiliation situation now. The city says you cannot pay a doctor, $30,000 a year or $28,000 a year. On the other hand, they give that money to the affiliate, the voluntary hospital, who will pay that doctor not $30,000 but $48,000 plus all the fringe benefits, plus an overhead factor, which is really profit for that institution. Now, how do you account for that? I mean, how can you explain that? How can the public understand the situation when it's your own money? Why can't you hire the people yourself? I mean, those are things that I think have to be addressed, because they keep on, postponing it. Why? Because there is a very big lobby of the voluntary system. They're powerful, there's a lot of money in there, but I think we have to fight that.
Where's our Rolodex? I'm going to make another mailing list to other people in the agency.
This is Theo. You go up with Larry. Larry, what are you doing, Larry? What do you want me to do? I want you to, each one of you spread, what do you got, 2 floors?
Second and fifth floor, the patients?
Take the 5th floor, you take the 2nd floor, I'll take the emergency room. To everybody. That means doctors, nurses, clerks, housekeepers, the whole works. Okay? I'm going to start spreading this throughout the building now. Now, tomorrow morning, that's the first thing that I want done.
Mr. Morales is being accused of not taking interest in patients. I know it on good authority that he does, especially Hispanic patients who can't speak English up on the ward as well as in the emergency room. He helps our patients on the outside because, I didn't want to say it, I very often donate towards very needy cases. I can mention a dozen of them, but we don't have time for it.
How do you feel about Gouverneur, the city's decision to close Gouverneur inpatient services?
Well, I don't think it's a good idea. And well, in the first place, I don't understand about city governments and governments, period. Private business, everybody make profits. But in everything the city run, they always in a hole. I don't understand it. And like in my case, this hospital, I was just fortunate enough to even get here. And I've been around other hospitals trying to get admitted. I couldn't get admitted. And so when I finally got here, I was on my last leg, which is a fact, because this leg was giving out, and this one I just could move a little. And after I got here, this one gave out, and now this one is out. Oh, I didn't even know I hit my own leg.
Mr. Windsor, I've come here today as a concerned citizen of the community. I have lived here all my life, right? Jose knows that. And I find that we, the people of the East Side, have always been doing things for ourselves. We come from all different backgrounds, and I quote Jose, right? But we have one thing in common, as you can see today. This is our community, and these are our people. Okay? And we must fight for our people. We must not shortchange them. We waited many, many years for this hospital. I'll never forget. We had a foundation here, and for 8 years we worked, and we went to City Hall with candles, and all these old people, we all marched. 8 years we waited. And now we're just shortchanged. Why? Do you know that there are 30 people from Gouverneur in Beth Israel waiting for surgery? 30 people from this hospital are waiting. Do you know that?
Are you aware?
Do you know that? Well,
No.
I just...
Well, they should try and help out more for the poor people. Mostly around here is poor people. They should try and do much, much more for the poor people, but he's not doing anything for them at all. Very little what he's doing.
Would you like to tell us, say, maybe by name, who these reactionary forces are?
Well, there are many. Many. You might think I will start naming them. I may omit some. So I believe that the people know even better than I who those reactionaries and forces of the oligarchy are. And these people, as I've mentioned time and time again, will have to face the people in the tribunal of the people. You see, who will judge them and who will condemn them, because they are being condemned already.
Messages. What kind of a message to give to the people on the Lower East Side? Since this is for family consumption, I won't say what I'm thinking. So I'll think up a nice one. Historically, we've been at the shit end of the stick since we came here. Either we came here because some of our people thought that there was freedom here or advancement, or we came here because we were stolen from our place and brought here, or we came here because we were lied and we came here and we found ourselves here. There are many reasons historically why we should maintain not only the fight for Gouverneur, which is the immediate problem, but maintain the fight for our right to determine and dictate for ourselves our own needs. That's a preamble to say that when words stop, and I'm talking now about people using words, political contact, and all that other crap, when all of that runs out, I can't talk for anybody. But for myself, maybe I'll be angry enough to blow up something. To wish that I don't bring any more children into this situation so that they die. That's a heavy question, Tom, because I may be talking about brotherhood now. And I might be angry enough not to feel it. I think we're gonna have to fight dirty. I think we better learn how to fight dirty. I think we're going to have to learn to hate, because everything that we're suffering, everything that we go through is because of hate. What message? Try to keep from dying too soon. Try to keep from losing faith too soon. And be prepared to really
T-apostrophe-D. I mean, what's that abbreviation for? Continuation? No, it continues then. And probably the whole word. No, but but it's not gonna be the continuation from the other page. This is gonna continue on another page.
How many pages is the letter?
2 pages. Yes,
You
I
want to put
do.
it in the front of the letter?
Yeah.
Specify you want to continue the back?
Of course. Not that I could put it, I know I can. I just want to know what. C-O-N-T, apostrophe D, you mean. Naomi, just answer me this question. What's a minute? No. What's the C-O-N-T apostrophe D? C-O-N apostrophe C-O-N-T apostrophe D.
No, C-O-N-T apostrophe.
Yeah, but what does it stand to this? Is this sure? Yeah.
Continue.
Continue? Yeah, so that's not right. That's not what you should write on the first page, right?
If you put apostrophe D, it means like continued. Continuation.
The hospitals belong to the people. They should tax the rich and not the poor if they want to keep Gouverneur Hospital open. Come on! The hospitals belong to the people. They should tax the rich and not the poor. Hospitals belong to the people.
Gouverneur is not a community hospital. We don't have obstetric and surgery.
In unity there is strength. At Gouverneur, for all. Use it, don't abuse it.
There should be more cooperation from Gouverneur's affiliate.
We need surgery and obstetric in the Gouverneur Hospital to serve the Lower East Side better and to save the life of the community residents.
Lo que más me preocupa es el problema del cierre y el no cierre del hospital. Sinceramente me gustaría obtener una respuesta más específica y definitiva. Gouverneur should be a hospital of the people, for the people, and by the people. A community hospital.
A hospital must give better medical care.
The whole concept of community hospital is, in a sense, a revolutionary concept, and you can't accomplish it without revolutionary changes. That as long as the basic assumptions are maintained about health care, that, and most of the proposals, the reforms, the new National Health Insurance Bill included, are basically that we're not going to have any fundamental change in the kind of health care that people receive. What we can do here is show that certain things can be done. What we can do here is that we can teach people about what who controls the health system, and we can teach people that they have to fight for their rights around health care.
Once upon a time, in the city of New York, a lot of people for long and hard so the city would build Gouverneur Hospital on the Lower East Side.
We want Gouverneur! 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 We
All the different kind of people people residents in this hospital. And it took a very long time to be built. Finally, when it was complete, many of the local residents got jobs in the hospital. It was a very good thing. The workers understand the problems of their neighbors and try to help them. 但係下東城區只有一間市政府醫院，求醫嘅人越嚟越多，而市政府假裝睇唔到啦。Many patients came, even more than city have original plan for. 唔知點解啊？市政府突然間話佢話冇錢啊！咁我為咗解決經濟危機，咁我話周圍去揾啊嘛，想辦法點樣削減啲經費。所以嗰啲政府唔會攤台。Then one day, I was coming in this land. There was an economic crisis. New York City must find a place to save some money. He looked over his land and sees Gouverneur Hospital. 因此，高人係成為被要削減經費嘅目標之一。That's one of the places I must cut. Local residents are poor. They are mostly colored or old anyway. 但係高人嘅經費啊，啱啦，啲人又冇錢又冇權，大多數係有色人種或者係老年人，冇乜緊要嘅。咁為咗保持醫院服務，就工作嘅保障啦，工友同埋社區人士一齊商量點樣去反對政府削減經費。In the meantime, the workers and local residents know that they must help each other to fight the city's budget cuts. New York City comes to Gouverneur Hospital and looks for excuse to cut the program and lay off the workers. My God, that's literally an excuse. The workers call on the union leaders to help them. The union leaders assure them that they will take care of everything and that there will be no layoffs. New York City and the union leaders met. The union leaders only go through the motions of protecting the members. This actually agreed to 90% of the city's planned layoffs.
10. 9.
10.
9.
Okay, I agree with you. 9. 9.
我話公開投資啊，市政府交涉之後咧，咁市政府開廠高雲嚟開刀喎。雖然我哋高雲嚟冇手術室啦，但係政府都要開刀，都幾慘啊！你話？ So story goes like this. Now, with the negotiation settled, New York City go to Gouverneur to implement the cuts. Let's see how they did it.
Hey, please!
So we're going to try to talk and deal with them to settle with the people. And say, man, what is you doing? Taking away. Union people are around. But when you need them, You can find them. 大家今日都知道啊，係嘛？交會費啊，工會費要加，就揾佢嚟幫你手嘅時候，就揾唔到佢啊。
Workers and community people have rights.
No folks, we ain't getting no shit from you.
That money is to provide health care.
Get him! Get him!
Community people and workers.
Like our Gouverneur must become a self-sufficient hospital. Something like that.
Gouverneur must become a complete hospital.
Complete hospital. Listen.
You got more
Gouverneur.
hold tight, don't you?
Yeah, we got plenty
hold
more.
tight. Dame nega. Oh, you catch a hernia.
Okay, change it here. Someday I'll learn. Maybe we'll change the name to something like Deal Diamond, that's easy. I'm going to say to make it a complete hospital. I'm not going to use that word. Good, very good. Very good.
Oh, hi, Henry.
Hi,
Come on, you're closer.
You won't come on Monday.
I'm not too good at printing.
It doesn't matter.
Only way that Gouverneur will not be closed is by supporting this worker, refusing to be cut and lay off from their job. If Gouverneur is closed, administrator and every level is affected because Gouverneur no longer will be a hospital. So I think if we support each other in this way, we all could benefit from it. The only way Gouverneur could be saved is that these workers are not to be laid off.
little something. Just fight and fight to get attention so that we don't kick the bucket before the time is up. We need good medical care, and we need it fast.
Entre todas las flores, yo te traigo un ramo. Recíbelo bien, que este es tu aguinaldo. Bellísimas flores, aquí te traemos. Bellísimas flores del jardín riqueño. Traigo el clavel blanco, traigo la azucena y también te traigo la flor de hierba buena. Bellísima bouquet, aquí te traemos. Recíbelo bien del jardín riqueño. Bellísimo bouquet, aquí te traemos. Recíbelo bien del jardín